Hi, I'm Dr. Rasya Dixit. Ringworm infection, the term denotes that this infection looks like rings or round circles on the body. It is a very common fungal infection of the skin. This is caused by a group of dermatophytes. The name of the fungus is dermatophyte. It is an organism which can live on the skin. So whenever there is a person who is having excessive sweating, excessive friction of the skin, there is a loss of hygiene. So then there is an increased chances of getting a ringworm infection in those people, often seen in the underarm, under breast area, inner thigh area, buttock area, sometimes in the feet because of the recurrent wearing of socks and shoes. You can get a fungal infection of the toes, of the nails, of the feet as well. This infection is common in the scalp also of children, where it is spreading easily from one child to other and can present like a fungal infection on the scalp with loss of hair. So the name ringworm came because in appearance the fungus looks like round concentric circles on the skin, which may be dry to look at, scaly, there will be some powdery thing coming out, and sometimes it is associated with severe itching as well. Unfortunately, in India, this has become a big menace because of the use of pharmacy available multi-drug combination treatments which usually contain steroids. So what these creams which are dispensed in the pharmacy contains, they contain some antibiotics, some antifungal, but also a steroid. The steroid reduces the itching which is associated with the ringworm, but the fungus itself is allowed to grow, and that has now caused a big multi-drug resistant fungal infections have become very common in India, which is why when you think that you may have a fungal infection, first thing that you have to notice is please start paying more attention to the hygiene. Have bath 2 times a day. Wear freshly laundered clothes 2 times a day. So your clothes have to be washed separately by soaking it in detergent, hot water, and then dried inside out in the sun so the fungus can die and the fungus does not come back to your skin through the clothes. The reason why you wash it separately is that prevent it from moving to the other family members. In fact, ringworm infection is also called the Dhobi itch because Dhobis usually wash all the people's clothes together, and fungal infections used to spread from one person to other during the times when Dhobis were used more frequently. Now, how to treat it? One is, like I said, pay attention to hygiene. Then, please remember not to go to a pharmacy. Instead, please consult a dermatologist who can give you an oral antifungal tablet along with an oral anti-itching tablet and an antifungal cream, which has to be completed. The dose of treatment usually lasts from 2 weeks to 4 weeks depending on the severity of the infection. So make sure that you complete the course. Even if you feel the infection is completely gone, don't stop the treatment, don't stop the cream. Always the cream which is applied has to be applied not only to that affected area but to the neighboring area as well, so that the fungus does not expand further as it is increasing in the body. Second thing, remember, if there's any other family member in the family who is affected, they have to be treated as well. Otherwise, you're going to keep cross-infecting each other. And most importantly, if you think that you have taken the correct antifungal treatment, still haven't gotten better, you may have a drug-resistant fungus. In that case, you may need higher antifungals, so you need to speak to your dermatologist. Also, there are many other conditions which mimic fungal infections. So they are called erythema annulare, there could be eczema, psoriasis, which look very much like fungus, and you might be getting confused that is a fungal infection. So to understand which is the condition that you truly have, speak to your dermatologist who can do a few simple tests to diagnose and treat you appropriately.